Hello, everybody, and welcome back to the Autoimmune Mom podcast. Today's guest, I am honored, truly honored to have on. Her name is Dr. Terry Adirim. She's the author of the forthcoming book, The Prepared Patient. She is 25 years inside a part of the healthcare system that most of us will never see. Valuable resource of information there. She is a frontline doctor. She has played a role in health policy and also in health technology. So we could call her an expert in both of those. Dr. Adirim started her career as a pediatrician in the ER, and she went on to serve in the highest levels of the government, including the chief medical officer for the entire U.S. military system. She led one of the largest health IT modernization efforts in the country at the VA. To say that Dr. Adirim has some golden nuggets for us here at the Autoimmune Mom podcast would be a gross understatement. I am honored and privileged to introduce Dr. Adirim and welcome her to the show.
Yes, thank you. I'm so delighted to be here to have this conversation.
Oh, this is amazing because I know I've never had any kind of conversation like this one that we're about to have with anybody in my 16, 17-year journey in the medical system. So I think this could be eye-opening for a lot of people. And again, thank you for being here. So let's just jump right in. One thing I think a lot of patients, moms, autoimmune moms feel when they walk out of a doctor's appointment is a lot of times they'll say things like, I forgot half of my questions. I don't feel like I was heard. Maybe I was rushed. I waited an hour and then I felt rushed. A lot of times that happens. Should I have pushed back? When is it appropriate to push back? So I would be interested to hear what your thoughts are on all of that and what your advice for a mom who feels that way might be.
Yeah. Wow, you started with
Loaded.
the
I
big
know.
question. No, I love it though. I love it because it really gives me the opportunity to show both sides. Now, we're all patients at some point in our life, and I think all of us have been through this. Waiting in the waiting room, getting to your appointment, having only, a short amount of time, getting frustrated because you didn't, talk about those things that were most important to you. And then when the appointment is over, saying, oh my gosh, what am I supposed to do? I didn't cover what I came here to cover. I think that happens to most patients at some point. I think the more encounters you have with the healthcare system, the more likely you are to have that experience. Now, as a physician, what I want your listeners to know is that there's a lot of pressure on physicians to get through, the appointments or, like where I had spent my clinical career in the emergency department is to see a patient get what you need and come out of that encounter with the information that you need. Now, there probably is overlap between what the physician needs and what the patient needs, but they're not necessarily always aligned. So this is why it is vitally important for people to be prepared for for their encounter, for their appointments, right? Being prepared before you need that emergency visit, being prepared before you go to your appointment. So what does that mean? That means that you've already thought about and written down what are your top priorities for that appointment. And that's especially important for people who have chronic conditions, like people in your audience. Because if you have a complex medical condition like many of the autoimmune diseases are, you're going to have multiple problems, right? So, for that visit, what are your top priorities for that visit? And if you already can write them down and know what they are, then that's part of the way to what you need to get out of that visit. I think too, you can direct that visit by going into the visit and say, Doctor, I'm here because I have X concern. Since I last saw you, this is what's been happening. So writing these things down before the visit really will help you articulate them when you get into the visit, and you can drive the conversation. Now, your physician may have other priorities that may or may not overlap with yours.
Yeah.
But I think there needs to be that equal partnership between patient and physician.
I think that's great advice. I find a lot of times for me, I'm back at the doctor every 3 months. So sometimes it just feels like we're all here to check a box. And sometimes I'm feeling well enough. I don't need to say much. It's just really I'm making sure that my labs are okay and everything else is fine. And other times, um, I do stumble across what to say and how to say it. And is this really a like is this really a flare I'm feeling, or is this worth mentioning to the doctor? Is it not worth mentioning to the doctor? So I I'd be interested. Do you think almost all of it is worth mentioning? Like I know for me in particular, if I have a little flare in my hand or something, a lot of times I won't even say anything to the doctor because I don't want to change my medications. They're working generally well for me or whatever. Um, and other times, I just don't know. I don't know what's appropriate to say. What on the level of 1 to 10? Where are you in your pain? If I'm a 5 or lower, for me personally, is that worth mentioning? I don't know. Do you? What's your advice on that?
Yeah, well, I think you've answered the question because
Yeah.
just what you are saying is exactly what you should be saying to your physician.
Okay.
Doctor so and so. Since our last visit, I've been feeling pretty well. I think the medications are doing well for me. I just want to mention that I had a little bit of some pain or, swelling or whatever it is in my hand. I would say it's a 1 out of 5. But I think overall I'm doing well. I think that's perfect. And then between you and your doctor, you can have a conversation about what that particular symptom or that you've come up with. You've also given your value statement, right? You've already said that this is, doesn't seem to be really bothering me. I think overall I'm doing well. So that you've kind of told your doctor, what your priorities are, right? Overall, you're feeling really well. You think everything's going well. But you did get to mention that, I don't, you could say outright, I don't know if this means anything, but I'm having some swelling in my hand. It's really not bothersome, but just letting you know since my last visit, this is what's happened. You sound like a really experienced, really good patient because physicians want, physicians want that specificity. And I think if you're, either, I'm not going to say inexperienced, but if you don't come to your visit already thinking about what your priorities are, what your values are, and what's important to you, um, it makes it hard for your physician to address really what your concerns are. So I think you're a great example. I think you gave a great example
Well, thank you.
of how to, be with your physician at your
I think
visits.
sometimes it's just a matter of, like I said, 17 years I've been going in and out of doctors for every 3 months, mostly, sometimes 6, but every 3 months I tend to be there for medicate for labs and things. But I did have to learn. I mean, I wish there was a class, and maybe your book is what we need. This is going to be the master class of how to be a good patient because a lot of us are not feeling well enough to even think about. They just want to go there and they're just so in such a bad way. And maybe they couldn't even walk in the doctor's office without help. And to like spend time and energy thinking about what do I need to do to be a better patient? I don't think that ever crossed my mind, not even once. Um, so I'm uh, very interested in this and the psychology around it. How can we all make this a better? It's not all on them. It is on us too. Like they're not mind readers. They do need to be told
Mhm.
all of this. So it's interesting. Why do you think it's so hard for patients with a chronic illness in the medical system that we're in right now, as opposed to an acute? I mean, you were in an ER, so it's slightly different. But
We
uh,
see a lot of chronic patients in the ER.
okay,
Right?
there you
A
go.
lot of my
Yeah.
patients were medically complex kids or kids with special health care needs. So, and they were the inspiration for my book because most of them, their families were really prepared. They would come with these white binders, and it was always white binders with all of the information that they need for that, an emergency comes up, they already had all of these things written down, their medical conditions, their problems, their medications, their doses, when their last doses were, all allergies, who their physicians were, all that information was contained in this binder so that when an emergency did happen, when the family is stressed, when their kid is sick, and if it's an adult with a condition, I mean, you nailed it, right? You're feeling like crud, right? You're feeling horrible. You don't want to have to think through these things. But if you're prepared beforehand, before the emergency encounter or before your your uh, primary care or your specialist visit, then you're relieved of that responsibility of trying to extract that information
Yeah.
from your already adult brain. So I think it's vitally important, especially for people who are medically complex, to be prepared beforehand. Now, you nailed it when you said, physicians are not mind readers, right? I'm just telling you, physicians really, really, really want to help their patients, right? They don't want to just come in and check the boxes. I know that it feels that way all the time, but we are required to do some of that box checking. But for those, I loved it when patients came and they had all of this information and they told me what they needed, right?
Yeah.
It's super helpful, right? It relieved my burden for taking care. I didn't have to guess. I didn't have to, do a lot of things or make a lot of phone calls. And I think that brings me to the answer to your question of why this is so hard for people with chronic conditions. It's because our healthcare system is so fragmented. The coordination is poor in a lot of cases. And unless you're cared for within one of those totally integrated health systems where all the information is available at the fingertips, and where perhaps all of your practitioners um, within that system, most people are not. So that coordination of care becomes difficult. And every time you go for your visit or you go see a new specialist or anything like that, you're having to repeat your story over and over again. Nobody likes doing that. I remember, a family that came to the ER. They were transferred from another hospital, and I was asking questions because I didn't know the patient's case. And the father said to me, "Well, isn't it in your," pointing to my electronic health record? I'm like, "Well, I wish it were, but it's not, right?" And even if it were, an extra layer of frustration for the clinician is that that information is not necessarily in a way that it's quick to access,
Yeah.
right? One visit could be like several hundred pages because of the way EHRs are set up. We're starting to see some improvements of reducing that friction with AI in helping to summarize patient notes. But otherwise, physicians, until we get this right, physicians are going to ask you again, and patients are going to be frustrated, rightly so. You're tired. You were seen by, another physician, and now you have to go through every single little thing again because you're seeing a new physician. I feel your frustration. And that's why I wrote this book because I really want, one patient is not going to fix the whole fragmented, opaque, broken system, but you can take care of yourself and try to achieve as optimal an outcome as you can in such a bad system. So
Right.
hopefully it does that. It helps people prepare for all of these situations.
Well, it's interesting that you say that, like, children's parents would come with binders
Mhm.
of books, and maybe what we all need to do as patients is start approaching our own healthcare as if we were approaching it for our child, because that's when you flex the assertion muscle, and when I talked about this in another episode where you don't do for yourself what you do for your kid, but once you do it for your kid, it becomes a muscle that you flex and you're more able to be more assertive and more, maybe assertive isn't the right word, but organized and prepared, and you would
And
and
empowered.
empowered. I would never go
Right.
to him if my child were super sick, God forbid, with something. I would never go to the doctor without information about my child. But I did that for years for myself. So, uh, let's talk about your white binder method, or how you developed it, what it looks like, and yeah, maybe this is something moms need to focus more on, is treating themselves more. as a priority and putting all this information together and just having it. So I'm interested to
Right.
hear about it.
So insightful that those comments about we'll do something for our children that we don't do for ourselves. And you're exactly right. And I would say I would teach, trainees, I would say parents are right more than 90% of the time, right? These kids with special needs, right? If they tell me something, I believe them. They know their kids, right? But when you go into adult world, that may not always be the case. A patient may not know all of their medications. This really happened to me during training. Oh my God. Um, I was in my pediatric emergency medicine training and I was rotating through a general emergency department where it was only adult patients. And I remember walking into a patient room, and the patient was there by himself, a 70-year-old man. And I said, "What are your medical problems?" He said, "Don't have any problems." I said, "Okay, what medications are you on?" Not on medications. Just then, his wife walked in after parking the car with a bag full of all kinds of medications. And I said, "Sir, why don't you tell me what medicines you're on?" "Oh, you mean the pills?" "Oh, yeah, yeah, I'm on the green pill, white pill, whatever." And you never see that in pediatrics.
That's my father. You might have had my
Yeah.
father that day.
Yeah, I did. I saw your father that day. And it was a huge lesson for me that exactly what you articulated. We don't see that with parents of kids with medical complexity. They come with a white binder that has a list of their medications, their dosages, the pharmacy, when their last dose was, if they're on G-tube feeds, the type of formula, the last time they changed their G-tube, like seriously. Um,
Detailed information. Yeah.
Detailed information that I just didn't experience in adult world. But the white binder method, I call it that because the inspiration for my book were families of children with special healthcare needs. They just were really a delight to work with because they it was a partnership, right? It was not a physician dictating stuff. They were equal partners and they could be assertive with their care and they were empowered for their children. And I want that for all patients, even adult patients. And because you see that less often, just as you said.
Yeah.
And the white binder is something that, and I put this in my book, what type of information you need in it. Now, it doesn't have to be a physical white binder, right? We're now in the electronic age, so you can keep it on your computer, or, and there are companies that are now starting to come up with products to help you with this. But it should have information about who your doctors are, their contact information, your pharmacy, your medical diagnoses, um, your medical coverage, right? It should be a place where you keep your EOBs, your explanation of benefits and bills, and the medications with their dosages and all that information that you need that you're going to be asked when you go to your doctor's office, right? Don't ever assume that especially if you go see a new doctor, that they're going to have any of this information.
Yeah.
And they'll make you, and it's frustrating because believe me, I just switched to a new primary care doctor and I have to fill out all those forms again. It's frustrating,
Hmm.
right? But
For
if you
sure.
already have it somewhere, whether it's in your white binder or electronic white binder, whatever you have, if you already have it at your fingertips, then it becomes easier
Easier.
to do that. And unfortunately, because as I get back to our fragmented, broken, opaque healthcare system, we need to do this for ourselves.
I agree. I think especially early on in diagnosis too, people is like they suffer for so a lot of us in the autoimmune
Mhm.
world suffer for a long
Yep.
time before they get a diagnosis. They get the diagnosis and they feel finally they're going to fix me. And they show up to the doctor and it's not that easy. You're going to try and fail. I mean, I can speak for rheumatology and Hashimoto's, but like try and fail a million different, hopefully not a million, but a lot of different medications before something sticks and finally works. And I think like that there could be a better level of preparing patients when they get a new diagnosis for what this is going to look like. I had no idea. I mean, I had no idea what any of it was. I have no experience in the medical system either. So it was depressing as further time went on that I was like, well, I'm no better than I was. Like, how am I still here? Now I am
Yeah.
better now, and we've gone through the system, and now I have expectations and things like that. But there's a definite disconnect between initial diagnosis and what things are going to look like. I did have my very first rheumatologist say to me, "You're going to be fine. It's okay. You're going to be fine." Um, but that was all that was ever said about what the path looked like going forward.
Yeah.
And I think, I don't know who needs to hear that, but for
No,
me, it
I
would have
I
been
hear you.
really
Yeah.
more it would have been a lot easier and digestible if they had just been honest with me. Like, this is what's gonna look like. We're gonna try this medication based on what your insurance says and doesn't say, and we're gonna see how it works. It's gonna take 6 to 9 months or 3 to 6 months or whatever it is for each drug. And if that doesn't work, then we'll try this and then we'll go forward. But like, I just kinda had to learn that over the years. And
Yeah, I think there are doctors who do that,
yeah.
and that's a best practice. Nobody should leave their appointment not knowing what the plan is. Now, especially with autoimmune diseases, a lot of the symptoms that somebody could have are very nonspecific. That's what we call them,
Mhm.
nonspecific. So it could apply to a good number of conditions. So we like to say in medicine, the history is everything. You get a history, you can make the diagnosis. But oftentimes, with some of these diseases or conditions, that may not be the case. You get the history, and there's still, well, we have to look at the physical, we have to do lab studies, we have to do all of this, and putting all that data together. But as you said, that should be told to the patient, well, I don't know right now. And a physician should feel at ease doing that. Believe me, I work in the ER. I say that every single shift, right?
Yeah,
Like,
yeah.
I don't know what you have right now, but here's what we're going to do to try and find out, right? Um, and help them with their, especially their biggest fears. I would always say a couple of things. One, especially if I was certain, I would say, okay, first I want to say it's not cancer. I don't know what it is, but here's
Yeah.
here's the plan, right? Because everybody always fears the worst, right? Um, I think too, not only saying you don't know, but sometimes medical science does not have some of the answers and or treatments
Mhm.
that work, right?
Right.
So even telling patients that can be very helpful. Now we're in the day and age of AI. And so I think AI is going to be that thing that levels the playing field a little bit. We used to do Dr. Google, and people would Google that and you'd get all kinds of trash on Google. So you could kind of look up your condition
Yeah.
and you kind of say, well, gee, what site should I look at? With I think you can get a lot more information that could be helpful to you. So you could put in there whatever your condition was, whether it's Hashimoto's, lupus, or IBD, or whatever autoimmune condition, and you could get an idea. It may not be specific to you because AI doesn't have that context, doesn't know you, didn't do the studies, but you could at least get some more information that you could then take to your physician to begin a discussion. So I
Okay.
think that it overall AI is going to be helpful to patients like you and your listeners to level that playing field and to help start that conversation.
And how would you advise a patient like myself or somebody newly diagnosed to use AI prior to their first appointment or within the first year of their diagnosis when they go see their doctor?
I would never tell someone not to use AI, but I think that there's because we all do. I
Yeah.
mean, for whatever.
Well, you're going to do it whether you're supposed to or
Right,
not. That's
right, right.
just, yeah.
But you need to use it effectively and safely,
Right.
right?
There's wrong
Um,
ways to do everything.
Exactly. So the first step is understanding that, general LLMs like ChatGPT, Claude, Perplexity, Gemini, all of these general large language models are not perfect, right? And they may say things that are not accurate with certitude. So you need to understand that it's not perfect. They also don't know your condition, right? They don't know you. They don't know what your history is unless you put it in there. So if you're going to put information in there, I would first of all, do not upload your medical records because you don't know where that information goes and it's private information. Don't ever do that. But you could put in there, I'm a 45-year-old woman. I've got pain in my hands and my feet. I have swelling here. I have fevers, every couple of weeks. Whatever your symptoms are, what is my likely diagnosis? So you can do that and then bring it to your doctor and talk about it. You could you could use it for, well, I just got my lab studies back and I have a rheumatoid factor of X. I have IG, whatever, as this. What are the likely, issues? Am I in a flare or, an exacerbation, whatever the term depends on the condition. You can do that to help give you some information, but it is not the end of the story. It's not definitive. It's just information that you can bring or to ask your doctor whichever way that you communicate with your physician. So there are do's and don'ts, and there are safer ways to use the system. But I think the more specificity that you can give, the better the information you're going to get. But you still need a physician in the loop. The tech people talk about a person in the loop. In healthcare, we talk about a physician in the loop.
Yeah,
So
yeah.
that would be my advice in using it. I would never say don't use it because people are going to use it.
For
So.
sure, for sure. You can't
Right.
help it. Um, it wasn't a thing when I was around, so when I was interested in all of it. So it's not something I've ever put in there outside of maybe a lab marker being a little bit off and me wondering what that is because, I don't, this
That
is,
happens all the time.
yeah,
Somebody comes and says, they have all the if you do a whole slew of labs, the chance of something coming back abnormal is really high,
yeah,
right? So you do like a whole bunch of labs and you do a lot of labs on adults and it comes back, well, my ALT, my liver function is normal, but my AST was a couple points above normal. Oh my God, what does that mean? Right? I get that question all the time, not necessarily that specific one. I'll look at it and I'll say, it's nothing for you to worry about, right? Especially AST over ALT. So, but people don't have access necessarily to, a physician in their family or a friend. That's where, these, AI may be able to be helpful
right.
in helping that. The problem is that it could give you a wrong answer and say it with certainty. Oh, you don't need to worry about that. When, yeah, you do need to
Yeah,
worry
you
about
have to take it with
it.
a grain of salt. It's not an
Correct.
actual medical degree
Right.
doctor that you knows your whole history.
Right.
Um, But it's good to note. I mean, because some
Hmm.
people are, it is relatively new enough that people take everything it says at its
Hmm.
face value, kind of like the
Well,
internet
think
back in.
about where it scrapes its data from. Okay.
Yeah.
It scrapes it from the internet,
Yeah.
from places like Reddit and other whatever, where, TikTok, I don't know, but where people say all kinds of stuff that's not accurate. So, Um, yeah, I think I think we're in the wild west right now. I think, people are going to use it because it's there, it's accessible, it's easy to use, and they're curious and they want to know, and maybe their physician can't get back to them in a timely manner, especially now where there's laws that say that patients must have immediate access to their tests,
Yeah.
and it may come back quickly before a physician could get to you to, help you through that. So, um, I think we'll get to a place where it'll be even more useful and hopefully safer than
As
what we're
as the
experiencing
technology
now.
grows and they
Yeah.
figure out things, yeah, it'll be interesting to follow it along. Here's a question for you. What information do doctors secretly wish the patients would bring with them? Be more prepared with? Maybe we touched on that a little bit, but
Yeah, I'm
uh,
not sure it's a secret though,
yeah,
but may not be evident to patients. But I think it's so helpful to physicians when you come with what are your top priorities, right? I think it's important to understand a patient's values, like what is important to you, especially when you have a chronic condition. Um, and I think also physicians want to know what has changed since I last saw you, if it's somebody that you have a continuing relationship with, right? Um, and if it's a new encounter, what are your diagnoses? What medications are you on, including supplements? Because they can interact with medications. You need to, can you be pregnant? I mean, we need to know that, especially if you come to the ER. Is there a chance you could be pregnant? Because I want to do some X-rays, right?
right, right.
Things like that. So openness and honesty, I think, is very important, even for those things that may seem to be embarrassing, whatever they are. So being fully open with all the things that are important for that visit,
Think of
right?
it more as, a team. We're on the same
Mhm.
team here. We're trying to get to the
Yes,
same goal. We both need to participate equally in order to get there, to get a winning outcome. Um, uh,
exactly.
I'm a
That's
sports
exactly
girl,
right.
so that's better. My analogies always go back to sports. Um,
Which is good. I like it.
okay. Now, not that you would do this, but if a doctor interrupted you or you felt brushed off or, you felt unheard or unseen, what's a good way to redirect respectfully? Because everyone does deserve respect, and everyone has bad days, and doctors aren't perfect either, and maybe they're having a bad moment, and it happens from time to time. I know a lot of people are too intimidated to say anything and just leave feeling frustrated. So, what's a simple tool that we might be able to use to help alleviate that situation?
Yeah, well, I think you've nailed it. I think, going back to something I said earlier, the goals of the visit may overlap, but may not totally align, right? There are things that a physician needs to get out of the visit. There are things that a patient may want to get out of a visit. Now, you make an assumption I've never interrupted a patient. Like, I'm an ER doctor. I constantly interrupt patients, but, and usually it's when somebody is going on and on about things that are not
Don't matter.
helpful for that visit,
Yeah,
right? So you want to be polite, both want to be polite to redirect. The physician should redirect to, what's the most important uh, thing to discuss during that visit, whether it's an emergency visit versus, a chronic care visit. I think a patient has the right and they should feel empowered, though they don't, because you've identified the power dynamic is
mhm,
not, oftentimes there's that difference there. Um, you can politely say, I'd like to finish because this particular thing I'm describing is important to me. Just give me a couple of seconds to finish, right? You can do
yeah,
that. And if it were me, I'd be like, oh, gee, I'm sorry. Yeah, I
yeah,
interrupted, right? So I think, as you said, both can be polite and direct it to where it needs to go. From a physician standpoint, there are things that we need to know, and we're rushed and we're pressured and so on. But at the end of the day, we need to do what's best for the patient, and the patient knows what they want to get out of that visit.
right,
So I think you nailed it. Being respectful and saying, doctor, I know we don't have a lot of time, but here's why I'm here, right? Um, I think sometimes it's not that common, but sometimes, there are patients who want to tell a story. And that's great. And so that's why
yeah,
being prepared is helpful, because if you actually think about what you want to get out of the visit, you can get to the actual core of what it is that is the problem and try and, brush away some of the extra factors that may not be as important as that core issue. So being prepared, writing down beforehand what your top priorities are for that visit, I think will help keep what you're saying as a patient a little more succinct, and keeping your physician on track. So I think at the end of the day, it's just about being respectful,
yeah.
both,
I
both
would
sides.
imagine it's hard for you in the ER. I mean, you're in emergent situations, and there are people who just wanna talk about everything and anything. So I would imagine that you would run into that, and it could be more difficult than a regular visit every 6 months or 3 months or something like that. But you do have to, um, be respectful and mindful, and, it's a two-way street. We're on the same team. We're just trying to get to the same place, and, yeah, I think that it's good to remember all of that.
And if you trust your physician, which I think trust is really important, and most people do trust their physicians, um, I think trust that they need to get information that they need to help you, right? So if they do redirect, um, I think if you trust your physician, then hopefully that physician's taking you down the path that you mutually,
And I
you know.
don't know that it's
Right.
a bad thing, so if they ask you a question that seems not anything around like, "Oh, that's interesting, why what would that matter?" Or something like that, like, "What are we trying
Yeah.
to what's the goal with that question? Because I never thought about it that way," or something, like, why would that be an issue.
Right. You bring up a really good point. And I think it's important that patients feel empowered, and oftentimes they don't, to ask those questions.
Yeah.
So if your doctor says to you, during a visit, "Oh, I'd like to get an ultrasound," right? Do you have any questions? And then you say, no.
Yeah.
You are within your rights to say, what are you looking for? What are you hoping to find? Is this test necessary? I'm trying to inculcate that in my kids, right? My
Well, that's
daughter
what I
went, yeah,
okay.
for a visit out recently with her doctor and wanted to do a certain blood test. And when she came home, I said, well, did you ask her why she was doing that test? Nah, I didn't think to ask that. Well, you're within your rights to ask that because I don't see any indication why you needed that. So you need to, right? I do that at my visits. If my physician, and I, of course, a physician,
Right.
and I've actually said, well, the American College of Obstetrics and Gynecology doesn't recommend that. And then, of course, my doctor will say, well, I don't always follow. Oh, why don't you vote? Anyway,
Yeah.
but patients have a right to ask, why something is being done, why you're being put on a medication, what do you expect from either that test or from this new medication. So,
I think that's really good information. And my mother is a nurse, so she'll often ask me these things. I'm like, I don't know, but I would
oh,
if I was in the going back to your children, if I was in the doctor with my kid and they were like, "Let's run an ultrasound," I wouldn't just be like, "Okay." I would say, "Why? What are
right.
we doing?" But for me,
You're like,
okay,
okay, doctor. Yeah, yeah. Right,
it's
right.
like this new light has been shed. Now I need to start treating my own physical health the way I would treat it as if it were my child's, and maybe
It's a
I would
partnership. Your
yeah,
doctor's not there for him or herself, right?
right,
They're there for
right,
you. So, and not only that, but you need to understand what is going on in order to do whatever it is that you need to do to get well, right?
right,
If you don't understand why you're put on, a different medication, like what makes you think this is any different, then you may not do what needs to be done to stay on that medication, especially if there's side effects. I mean, under those circumstances, your doctor should be able to say, I know that there's these side effects, but I think overall this is going to be better for you because it's going to do X, Y, and Z, right? Once you understand that, you may be more likely to continue with the medication where you have some side effects, right?
right,
So,
right. Yeah,
yeah.
yeah. Interesting. All right, let's switch gears and talk about the dreaded insurance business. I'm interested though in your perspective as a doctor, and I mean, I've had conversations with my own doctor about treatments being denied and uh, fighting things. And I think I mentioned to you first time we spoke a little bit about the situation currently in where my insurance did cover my infusion and now they've said they're not going to cover it. And um, they'll do it if I go to an infusion center, but not when the physician purchases it. My doctor doesn't do the infusion centers, they purchase the medication. So it's either I get a new doctor or I get a new insurance, basically, is where I'm at. So I'm not getting a new doctor. That's too much. So we're looking into new insurances. But how can we as patients advocate stronger for ourselves? What do you advise people do when it comes to insurance and all of this stuff? I don't even really know where to begin with the question, whether it's with denial or just insurance policies in general. But any information you want to share with us about how to better advocate for ourselves as patients in the insurance world?
Yeah. So that's a very rich question. It's a
Yeah,
very good question. It's something that confronts all of us. Well, I won't give you the insurance example, but what I'll say is that it helps from the very beginning if you have a choice in insurance, especially if you have a chronic condition, to look into um, who is in network versus out of network because that has an impact on what is covered and how much is covered. So that's number one, especially if you have a chronic condition, and most people in this country do. Over 50% of people do. The next thing is what your copay, co-insurance, and these are all terms that I explain. It's the largest chapter because most of us don't know this stuff, right? Only
right.
12% of people in this country are fully health literate, right? So it doesn't matter how smart you are, it doesn't matter how educated you are. A lot of these things are alien.
And they change frequently.
They can't, well, no, they change annually.
Yeah,
So
yeah.
I'll talk about that in a minute. But so understanding what your insurance covers, what it doesn't cover, and doing that if you have a choice beforehand. right? So if you're going on the exchanges, the marketplace plans, really doing that comparison, especially specific to your condition, looking on the website for what is on formulary. If you're on multiple medications, that's really important, especially the more expensive ones. Are they covered? That is key. Now, a lot of people don't have a choice in insurance. You should still look into what's covered and what's not covered because you need to know what to expect. You may need to increase your savings. You may need to do a lot of things. And then there are people who are uninsured. So and people have to weigh, especially now that they're, that they've taken away the subsidies for the marketplace plans. A lot of people have chosen not to be
I
insured.
know many people, and in
Yeah,
fact,
it's
right at this
yeah,
moment, I'm uninsured because to pay
that
that kind of money for me
yeah,
not to have my treatments was insane. So,
yeah,
we're not actively shopping, and this is not a solution by any stretch of the imagination, but I'll just cash pay for whatever I have to between now and when I find a plan that actually works for me, because these ones
right.
are not working for me, and it's a
Yeah.
full-time
What
job.
I tell people is that I know insurance sucks. You're paying a premium, you're paying all this money out of pocket, and there's all these new $14,000 until your insurance kicked in. Like it's really,
Yeah,
unexpected
it's
hit to people's
astronomical.
pocketbooks. So what I tell people though is that you're taking a risk because you don't know if you're going to be diagnosed with a condition. You don't know you're healthy now, but you could be diagnosed with a condition and or you're one car crash away and a
From anything,
hospitalization
yeah.
from needing it. I have a friend who's a physician who ended up healthy woman had a medical condition unexpectedly, not only had to have surgery, was in the ICU, was hospitalized, ended up with a ton of medical bills despite the fact that she was insured. She thought her insurance was covering it, and it got sent to uh, to collector, even though her insurance hadn't yet, um, you know, decided yet what they were going to pay and not pay. So this is where you get to. You need to appeal these things. Most people do not. I mean,
Right.
I've seen numbers like only 1% of people appeal um, you know, either a prior authorization or a denial of payment or a wrong bill. And I always say, take a deep breath. And if it's a bill related problem, ask for an itemized bill. Okay. And you say, I am looking into this, I'm appealing this. If it's a surprise bill, you say, this seems to me to be a surprise bill. That'll stop that process from going on. If it's a prior authorization, a lot of chronic patients may be on immunologics and other medications, which are very expensive, that your insurance may say you need a prior authorization. Your physician would do that. But if it's denied, you need to really engage with your physician to determine what info, don't let this go. And it's not fair and it's a pain in the neck and it takes a lot of your time. But working with your physician to get the information that your insurance company needs in order to cover it. Most people do prevail when they appeal any of these things. And so it is always worth appealing, even though it is painful, even though insurance companies either make you do it by phone, which you could be on the phone for hours. And I'll tell you a personal story in a minute. And then, or you have to type something up and send it by mail. It is really insane how that works.
Yeah.
My doctor and I had talked about, I said, "You know what? I really want to get a CT calcium, cardiac scan. I wanna know that I'm getting at an age where, for women, they're postmenopausal,
Mhm.
heart conditions." So my doctor said, "Yeah, I'll call in that prescription for you." So I spoke with the radiology center and they said, "Oh, your insurance doesn't cover it. You're going to have to pay out of pocket." I said, "Yes, I know. Yes, I want it. I'll pay out of pocket." They told me it was $250. I said, "Fine, I'll pay that out of pocket." So I fully expected I was going to pay that out of pocket. I get there for the test. I get handed my credit card. I paid for it. I was told this is paid in full. A few months later, after getting my results, I get a bill for $375. I called them up. Of course, this whole thing took me 2 hours and it was a second phone call,
Yeah.
right? So I had to call again of my time. I'm like busy and right. And I have to do this. And this is a small thing, right? I can't even imagine if you've got like
Yeah.
anyway, and finally, I had to explain to them, "No, no, no, I paid $250." And the person at some call center said, "Well, you're right. You paid 250, so you only owe 135." No, no, no. I was told on this day by this person that, $250 was the full amount, and she said, "Oh, oh, okay." I said, "I'm not paying it." So a couple of things about this case that should be illustrative to people who have way more of a problem. This is, I'm relatively healthy. I wanted this one test. Is document who you speak to, get a reference number, jot it down, keep it in your white binder, keep it somewhere.
Yep.
And because it may not be the end of story. And I know it's painful. I know people, especially people who are sick, it's just terrible. But if you go through that process, that appeal process, more often than not, you're going to prevail. It's when you don't appeal it,
Yeah.
people end up just paying it automatically and it lets them get away with it. Now, I can't explain fully why insurance companies do this. I think these decisions, policy decisions, are made on high by people who don't go through
Well,
what
yeah.
is
It's
painful.
money driven, obviously. Like they
Well, the prior authorizations originally had a good purpose. Okay. So you have to say that up front, right? The doctors will prescribe a lot of low value things that are not necessary kind of care. And that happens. Insurance companies say, well, we shouldn't have to pay for it. Right. But I think it's become, as you said, a way to reduce costs because healthcare, the prices are super expensive, right? A hospitalization could be tens of thousands to hundreds of thousands of dollars. And, they need some way in order to manage those costs. And so they use these tools for that. But what they don't realize is that patients are suffering. And to appeal it when you're sick is really, really hard.
and
And
it's
despite that, I
yeah.
still say appeal.
Yeah.
And I do go through the kind of list of what you should do, a sample appeal letter, and the fact that if you can't get satisfaction with your insurance company or the provider, if it's a hospital or whoever it is, then there are state laws. And there are within states, whether, it's a Department of Health, Attorney General, whatever it is, you can find that out and appeal through that. There's external ways of appealing as well. And it's painful, but I think we have to do it. It's
That's
unfortunately it's
sort of
just
the situation I'm in right now because they didn't pay for any of my treatments are like $9,000 a month from January 2025 until they stopped. And I got a monthly authorization every single month and in January a full year prioritization. So they get the full year and then every month they get another one and then I got a notification that my balance is $82,000, which is a business to business side, so technically it's not on me, like, because I have met my requirements, but I am helping the rheumatologist try to get their money because so I'm helping appeal it because it's not their f
good.
I mean, somebody should have figured it out well before a year went by that they weren't getting paid, but I'm trying to help them because it's the right thing to do, but I don't I don't even understand how it happened. How do you give a prior authorization every single month for, like, a $9,000 treatment and then say they're not paying?
That may be where you need to go to the state,
Okay.
whoever then within your state, insurance, overseas insurance, because you have a prior authorization and you've been given, that the approval for that medication and they're not paying for it, then the insurance, needs to be paying for it. So we need to fight them. And back to where you mentioned about changing monthly, insurance companies don't change monthly; they change annually.
Annually, yeah.
And so you need if you have a chronic condition, you're on multiple medications. And when you're on insurance, you need to check that. By December or so, they announce what they'll cover, what they're not going to cover. And so you need to know that during the enrollment period. And it's unfortunate that you have to do that extra legwork. It's not fair, but you need to take care of yourself. So,
Yeah, I
God, I
agree.
really hope that you find new insurance that
No,
it's
it's
covered,
my
right?
husband's
Yeah.
company is now offering it, so he just works for the small the thing I will say, and I've mentioned this, and my listeners are probably tired of hearing about my insurance issues at this point, but the healthcare in South Carolina laws or whatever for companies is nowhere near as good as it was in Massachusetts. There's a lot of things I hated about Massachusetts. There's a lot of things that I think the insurance is probably the one thing that I do miss the most about it. The insurance was much better. It covered a lot more. Um,
Right,
Here
and
it's been a
that's what
struggle.
seems so unfair about our system
Yeah,
and I think that's what the Affordable Care Act was trying to do was to create some kind of standards across the country versus being, you live in South Carolina, so you're going to get crappy insurance
Well, it
versus
shouldn't
living
be
somewhere else.
that way, right?
Right,
It
exactly.
shouldn't be dependent on where you
Right,
live. And I
right.
moved here for quality of life purposes. Like, I was miserable in the winter. I couldn't handle it anymore. Like, my insurance costs probably should have gone down because I'm moving to, like, a place where I feel better. But it's a
And and it's crazy because it's not only a burden on patients, but as you articulated, it's a burden on physicians because clearly, $82,000 not small change for a practice, right?
no,
And so it's a burden on physicians, but it is also a burden on employers. I mean, over 50% of people get their insurance through employers, and more, especially the small and mid-sized employers are dropping insurance and they're going with other types of things like Ichara, I don't know how they pronounce it, but where they may give you a stipend and you
that's
could
what we're
buy
in this situation now.
right, and that is not equal to what you had before.
No, it's not even close. We do
Right,
get some
right.
money every month for it, and it's helpful, but it's
Mm-mm.
crap insurance, and here we are.
Right, I tell people all the time, high deductible insurance is not really good insurance. And the reason why is because most people can't afford to pay whatever it costs before it kicks in. And then they say, "Well, you can save money, put money away." Most people live paycheck to paycheck.
Right.
Where are you gonna get the savings? I mean, with all of the unaffordability and the rising prices, going beyond I know this is going beyond healthcare, but go way beyond what people are earning and so on. It is really creating a crisis. And we're at a point where nobody is happy. And there's going to be
It's
a come to Jesus
1,000%.
sometime.
You're
Yep.
now we're supposed to save money for healthcare on top of saving money for everything else when we can't even save money for the gas tank. It's like it's hard at times out there, and especially when you're sick.
You
You
can't,
kinda wanna
it's,
just throw
yeah.
your hands up, and you can't. You have to keep fighting, and,
And that's why, my book isn't going to solve this crisis, but it'll at least help people with one tiny step to take care of themselves. Because if you're armed with information and you have that information to help smooth some of the friction within, getting your insurance, within and understanding it, and going for your appointments and what to expect, during your life cycle, I think that's a little tiny step that helps people. It is not the solution to our healthcare crisis, and AI is not even the solution either. People think that's going to be a solution. It's going to help reduce friction, but I think there needs to be a moment in this country where, we need to say we need to change the laws, politics, you know,
yeah, a lot of it
all
needs
that.
to
Yeah.
change in a lot of different ways, and unfortunately, it's the people who make the decisions to make the changes are least affected by all this because they have good insurance.
Well, I don't know what insurance is considered good because
It's
people would
very
say to
low.
me, yeah, well, better than yours. Yeah,
Yeah,
well, it sounds like most are probably better. But
yeah,
but I had what was good insurance and you still there was a lot of out of
yeah,
pocket kind of
for
stuff.
sure, yeah.
So
I
it's
know the grass
yeah.
is always greener on the other side, but everybody has their problems, and even doctors don't have great insurance, and, well, before we wrap this up, let's end on a happier note. What gives you some hope about all of this conversation that we're having? Like, is there anything out there that we can, lean on a happy note for patients?
I think patients are becoming a little more empowered. And I think that's a good thing. I think, healthcare has risen to one of the top one or two issues that are important to families across the country. And I think that's going to impact who we choose to lead us. And I think within the next few years, several years, I think that there's going to be changes. Right now, we're only nipping around the edges, but I see that we're going to have that moment where we're going to see change. But I think the small things that patients can do for themselves is very, very helpful. And hopefully, my book can help with that. But the other side of this, the real positive thing is that we are finding cures and treatments for diseases that when I started my career, just didn't happen. I mean, the biologics, I mean, think about that. There's a whole different kinds of conditions that are now treatable that, that are so helpful and keeps patients out of misery. We're finding ways to diagnose conditions sooner. I mean, just this morning I was reading about how there are ways to diagnose pancreatic cancer sooner, and we have treatments that could actually cure it. I mean, this is a disease that 5% of people survive 5 years, right?
Yeah.
I think we've seen great strides in other types of cancers as well. So we take two steps forward, one step back when it comes to all of these things. I'm hoping AI too, that could be a positive area that helps reduce friction both at the front door to healthcare with all of those administrative kind of things, within the exam room with ambient AI scribes and summarizing notes that'll free up physicians from having to type while they're talking to you,
Yeah.
and that back end, back office kind of processes that hopefully that'll help smooth things out for patients. So again, it's two steps forward, one step back. Yeah, hopefully it does
Fair to
get
say
better.
doctors are ready for change too. Everybody is ready for change. We just and as patients, anyone in my community here, you can email your senator, your representatives, anybody. A quick email, it doesn't take very long. You don't have to be a huge advocate. You don't have to storm the gates or all that, but just send it like, "This isn't working. We're all like, we can't afford it. We need help. This is a major issue for your constituents," something like that. I emailed 2 of them today about something else in my town, but, it doesn't a little step everyone does a little bit, it can make a big wave, I think, so,
Exactly.
um, well, Dr. Adirim, you're a gift. Thank you for being on my show. I've learned so much. I think,
I've
I'm
learned from
definitely
you too. I like
have
the
you.
way you frame things. It's
Thank you.
awesome. Really great.
Thank you. I have a little experience in this world here. But I'm very, very interested in your book, and I can see where it can be, almost anybody. I talk to a lot of people who are newly diagnosed, like, you need this book. I'm going to gift you this book. It's going to help you be prepared and things like that. So I will definitely be interested. And when is it being published?
It's being published, it's being released on August 11th. It's
Okay.
available for pre-order on Amazon, and other book-selling websites, and it's called The Prepared Patient: Your Guide to Surviving the Healthcare System. And it's again not a fix, but a small step to helping people individually navigate this broken, not transparent, fragmented healthcare system.
That hopefully is getting better than it was. I think it is getting better in some respects. So we'll see. But be prepared. So, uh, again, thank you so much for being here, and, I really loved our time together, Dr.
Yes,
Padiar.
and
Thank
thank
you.
you for having me.
Oh,
This was awesome, and you're doing a great public service, so thank you.
thank you. Before we wrap up today's episode, I just want to say thank you for being here and spending this time with me. If this conversation resonated with you, it would mean so much to me if you'd follow or subscribe to the Autoimmune Mom podcast wherever you're listening, and take a minute to leave a review. It really helps other moms who are navigating autoimmune disease find this space. And if you know of another mom who might need to hear this message, please share the episode with her. You can also connect with me on Instagram, Facebook, and YouTube at the Autoimmune Mom Podcast, where I share encouragement, resources, and up-to-date updates on new episodes. And don't forget, you can download my free Autoimmune Mom Survival Guide using the link in my bio on my socials. Remember, you're not alone in this journey, and I'll see you next week at the Autoimmune Mom Podcast. Take care of yourself, Mama. Your health matters too.